Hey everyone, I'm Emily Rose. I'm a client partner at Facebook, and thank you so much for tuning in today to this interview brought to you by Exec by Facebook, which is a new virtual program where we're talking to our top partners about how they're solving for their biggest business challenges as well as managing business continuity during this difficult time. As we all know, COVID 19 has caused a massive disruption to most industries. With a remote workforce and changing consumer behavior and changing consumer needs, we're seeing some of our partners facing unprecedented demand, whereas others are seeing real challenges when it comes to operations, manufacturing, marketing, and just meeting consumer needs. What we've heard from our top direct to consumer partners is that they'd really like to hear about how their peers are approaching their business during this time. And knowing that, I thought it would be really interesting to dig into telehealth as our first subsector. With that, I'm thrilled to announce our first guest, Will Flaherty, VP of Growth at Row Health. Will, thank you so much for joining us today.
Thank you for having us. It's a pleasure.
So, knowing that Row is typically a New York City based company where everyone gets together with a lot of in person time, how have you been transitioning managing a remote workforce? How has the Row team been getting together virtually to sort of maintain their team's culture as well as keep consistent communications?
Sure. I think our business is interesting in where a large, but not all of our employees, large majority are working remotely. We do operate multiple pharmacies, and we've taken just incredible precautions and measures to make sure that we can allow for our pharmacy staff to come in and continue to serve patients that still need their medication even in these times. For the bulk of the company that is working remotely, we're fortunate that we've had some degree of our workforce remotely positioned already. So we have some organizational familiarity with that. But I think the big shift now with a majority of the company working from home largely has been trying to find ways to make sure to foster the type of social interaction that would normally happen, almost at random. When you think about teams often sitting together, there are all these small conversations that happen that kind of are now replaced by more structured meetings. So trying to find ways to make sure that we have kind of that inter-team collaboration and communication, but then also to keep things light. So one thing that we've done with our growth team, we're every day do an icebreaker where we will go and before we do kind of a daily check-in, we'll ask a question of what would be the first vacation destination you would go on the next moment that you can travel, or what was your favorite food growing up as a child? And so we'll collect those answers, and then we'll go around and kind of everyone will share those answers in kind of an interactive way. And so it's actually allowed us to get to know everyone else in the team a lot better. And doing things like that, we've done a weekly trivia. So every Friday, we split up into teams, and a little more than about a dozen or so of us, and we'll do a kind of a regular trivia game. So trying to do things to keep things fun and light, and at least try to the best extent possible simulate some of the spontaneity and fun of working together in the office.
So, one challenge that I know a ton of direct to consumer brands have been bringing up are around operations, warehousing, manufacturing. Logistical challenges have really arisen as a result of all of the disruption from COVID 19. How have you guys been managing those challenges? Have you seen that come up at all from a supply chain perspective?
Sure. I would say that I think, been fortunate in that, predominantly our offerings are prescription or medical in nature. That part of the supply chain has generally held up and been pretty consistent over the last few months. And then similarly, I think to the extent that we've been able to continue to operate largely in much the same way, state and local governments have realized that pharmacies are quite important to keep operating in these times. And so, again, we've done quite a bit then, even on top of that, to make sure that the environment in which our team members are going into work every day is as safe as possible. So, in general, we haven't seen huge disruption, and we don't operate in any type of retail environment, so nothing there. I think in general, the thought and principle that our service can be accessed anywhere with your phone is largely something that is driven around convenience. But I think in these times when you have other kind of restrictions to access different services or physical locations, it becomes all the more valuable for us. So we're fortunate to say not having had a real material impact, at least in that side of the business.
Interesting. And then from a marketing perspective, we've heard questions from a lot of companies that we work with around how to market respectfully and how to kind of find the right ways to speak to consumers during this difficult time. I can imagine that's particularly relevant to a healthcare company. Has Row changed their messaging? Has Row kind of taken any new strategies around marketing that might be interesting for our other partners to hear about?
I think the one thing that we've seen success with, and maybe would recommend for others to the extent that they can do this, is, we haven't dramatically changed what our core value propositions are. They remain the same. The ability to access a physician from your home has always been something that we found, and we found that consumers have felt was important and a key to our offering. So, in essence, these times have just, I think, allowed us to refine and articulate and hone in on the value props that were already extant in the product, but that matter all the more in this time, right? So, convenient delivery, at-home access, those are the things that we tend to emphasize more in our marketing in these times. And I think in general, I think consumers respect that. I think, we've tried to avoid, the kind of standard ads of, we know we're in tough times and we're here to support you. Honestly, I think at times those can become a bit trite. And instead, we want to focus our energy much more on what we can actually meaningfully do to help someone in a material way. So I think one example of that is when the coronavirus pandemic started to break out here in the US, we realized that we had a platform of physicians and technology that allowed for someone to interact with a physician remotely, right? And so knowing that we had that, knowing seeing the crisis kind of build and mount, a large group of our team members spent time building out a online coronavirus assessment tool. So the main idea here was to help give people a doctor-designed and doctor-oriented screening tool to understand whether they were potentially at risk for coronavirus, whether they may have had a higher likelihood of having coronavirus, and then if based on those answers we felt that they were at a high risk, we actually could connect them with a physician to speak live about their current health situation. So that's something that we were able to really in the course of a week and a half get out live, and then really start sharing with our members, and then broader communities and other areas as well. And so that's something that we've seen really great uptick for, and it's all free. We haven't decided to, we have no intent to charge for that. It's really something that we wanted to do to really use our platform and our technology and our network for the greater good. And I think that we think in general, those are the types of initiatives that matter a lot more. Showing care and compassion by doing rather than saying has I think been our focus through this time.
And knowing we're in such a unique time for telehealth and telemedicine, what consumer trends is Row seeing from a broader perspective? Are customers using the service any differently than they were before?
Yeah, I think it's interesting where there's always been a component, when we think about, the different segments of people we're trying to, convince to use our service. There is a certain contingent of folks that have never used telemedicine before, that we need to get them comfortable with that experience of speaking to a physician. I think all the more so when in many cases, the conditions we treat are stigmatized. They're ones that people aren't maybe even comfortable speaking to their own doctor about in an office environment. And so I think one of the things that we've seen is the very broad adoption of telemedicine, and seeing health systems and insurers and medical offices really move much more quickly to telemedicine as an offering, and really speak to their constituencies about that, I think has helped really reduce that barrier for a much broader swath of people than we ever could have addressed through our own marketing, right? So we've been fortunate that kind of macro adoption of telehealth I think has allowed for a broader range of consumers to feel much more comfortable using a service like ours. And by no by no effort of our own, other than, and that's the way that the kind of macro environment has changed. We certainly, I think, have always held the thesis that that would occur over time, just given the way that consumers have adopted digital technologies for all sorts of different needs and consumer services. But particularly, we would not have expected it to have happened this fast. I think we're heartened by that, and heartened by the confidence that consumers are now putting in us, that maybe wouldn't have been so comfortable even 2 or 3 months ago.
Now, as you've said, due to this consumer behavior shifting, you anticipate that telehealth will be impacted broadly. Do you anticipate that these behavior changes that users are sort of undergoing and being more amenable to testing out telehealth solutions is going to be a permanent change?
Yeah, I think, kind of as I just mentioned, I think we're in this business partially because we know that telehealth is a way to help better serve our country's healthcare needs. It's more affordable. The access, the ability to interact with a physician. We found, there are hundreds, if not thousands, of counties in the U.S. where we have been able to treat someone where they didn't have access to a specialist, or they were a lengthy drive away from the nearest medical facility. And so there's an element of telemedicine providing access and expanding one's ability to actually interface with the healthcare system that I think more and more people are realizing, and we do think that shift is more permanent. Granted, there's not you can't treat everything through telemedicine. There are certain limitations, but many of those limitations will start getting closed over time, right? As at-home testing improves and diagnostics improve, wearables that allow for a physician to collect diagnostic data to render a more accurate and more more clear-cut diagnosis of a condition or treatment plan. All of those things, we can really see those trends accelerating, and we do think it's a kind of continued shift, and we probably won't look back from this moment.
Really inspiring story. Thanks so much for sharing everything you guys have been working on. It's definitely a unique position in terms of being in the telehealth space right now. And I know that our partners are really going to love to hear about how you guys are managing the challenges that come with working today. Just to end things out on a lighter note, have you picked up any new hobbies during quarantine? What's new about managing your work from home life versus kind of being out and about in New York City the way we were before?
Yeah, I mean, I think the first thing was the realization that I need a proper desk. I haven't had a good workspace, and so I had a kind of an extra, like, daybed type couch in my apartment, and I just got rid of it to get a desk. You need to kind of set up for the long haul to have a proper workspace. So I think that's critically important. And then in terms of hobbies and such, like, probably like everyone, a lot of cooking projects. I've kind of always enjoyed cooking even before this, and now having that be kind of the main way one needs to feed themselves. Have taken on a bunch of different things. So I've done kind of a take on barbecue brisket in a immersion cooker at home, which was fun, and kind of different projects like that. Baked my fair share of banana bread too, so probably like seemingly everyone else on Instagram these days. But a lot of cooking, a lot of a lot of things around the house, and really just, I think, trying to keep myself engaged and healthy, and looking ahead to better days moving forward.
Absolutely. Thank you so much for sharing, Will. It was great to connect with you. So happy to see that you're doing so well and are obviously healthy. Thank you, everyone, so much for tuning in for this edition of Exec Connect by Facebook. We'll see you next time.